Right, welcome everyone to episode 21 of our What If interview series, where we discuss and share knowledge on customer experience, digital transformation, and how to better serve customers via digital channels. My name's Luke Stamper, and I'm a content marketing executive for Mando. We are a digital agency committed to simplifying digital experiences for everyone. So we work with regulated industries or companies within regulated industries like energy, utilities, and financial services companies, focusing on helping your customers to do those tasks that they don't really want to do. So we don't all wake up thinking, yes, brilliant, I can't wait to go downstairs and pay my water bill and renew my car insurance, or at least I don't. And we make these experiences easier, giving time back to customers so that they can do more exciting things. So today our title is What If 1 in 6 of your employees are experiencing poor mental health? To discuss this topic, we're joined by Mando's HR and Wellbeing Lead and Managing Director of DEWA Consulting, Dee Walsh, and Jake Mills, CEO of mental health charity Chasing the Stigma. When Dee's not protecting the mental health and wellbeing of the Mando team, she offers open and in-house certified training courses and a range of services from full strategy and policy implementation to content plans and workshops for HR teams, line managers, and mental health first aiders. Jake founded the multi-award winning national mental health charity Chasing the Stigma, which he established following his own battle with depression. Jake has also created the Hub of Hope, a groundbreaking mental health database that has since become the UK's biggest and most comprehensive mental health signposting tool. So before we get started, just to let you all know, we also have my Mando colleague Sarah Davies on the call with us today. Sarah will be helping with logistics and monitoring the chat. So if you have any questions or comments throughout the course of the conversation, please be sure to send them into the Q&A section, bottom of the screen, and Sarah will ask them at the end of the discussion. So we'll be chatting for around 25 minutes this morning, and then we'll move on to some questions or comments from today's audience. So I think I've kept you long enough there while I've done the opening gambit. Good morning, G. I've forgotten how to say your name. Dee and Jake, please could you introduce yourselves and provide us with a little information regarding what you do? Dee, do you want to go first? Or G, rather?
Morning. So I've been with Mando since 2015, but I've got 15 years in human resources. And I look after, as you've said, the HR and wellbeing of our staff. So around about 60 staff at the moment. And my role is everything through from recruitment and attraction up to being able to help people thrive within the business. And a big part of that for us is about their well-being, both physical and mental. 3 years ago, I decided to follow my passion, and I was very lucky to be supported by Mando in doing that. So I reduced my hours and set up DEWA Consulting. I went away and retrained with MHFA England, alongside training as a counsellor with the BACP, so that I'm able to provide proactive support to people with their well-being. So as you've said, I've delivered training and work with businesses to make sure that their employees are in the best possible health, both physical and mental.
Brilliant, thanks Dee. Jake, you're up next.
Yeah, I'm Jake Mills. I'm the founder and chief exec of national mental health charity Chasing the Stigma. As you said, Chasing the Stigma is a charity that was founded from lived experience, my own lived experience, but we want to use lived experience in everything that we do at the very core of our work. So everybody associated with the charity has in some way got direct or indirect lived experience of poor mental health, and we use that as a way to try and change the approach to our work, which is more about normalising mental health, humanising mental health, and using ourselves as a way of saying we're part of this. So we're not directing it to those. We're not saying it's you and them. It's saying we're part of this as well.
Brilliant. Thank you very much, both. So just to outline today's topic of conversation, I've recently kicked things off with like a couple of stats that really paint the picture of the topic of discussion. And this has generally been a really good way to start the conversation. So with today's topic being all about mental health and recognition of poor mental health in the workplace and how that's on the rise and how employers can protect their employees, I found some really useful stats, some really poignant pieces of information around that I think will really set the scene. Those are, so according to the Mental Health Foundation, 1 in 6 people experience poor mental health problems in the workplace, which is roughly around 14.7%. Better mental health support in the workplace can save UK businesses up to £8 billion per year. And research by Deloitte has also suggested that for every £1 spent by employers on mental health interventions, they get £5 back in reduced absence, presenteeism, and staff turnover. Dee, would you agree with these stats? And what is your sort of current issue or current understanding of the issue as it stands?
Yeah, absolutely. So I think what a lot of businesses don't understand is when they invest in well-being, in that education and prevention of mental illness, they save a ton of money, because what they're doing is they're raising awareness and helping people to understand themselves by raising that self-awareness and taking days off when they're unwell. Then it prevents that lack of productivity or lack of engagement or long-term sickness absence that we see in businesses that don't invest. So at the moment, we say generally across the board, 1 in 4 people will be affected by mental illness. We believe at the minute it's more like 1 in 2, because with the pandemic, we've just gone through the isolation, the difficulties, you know, it's all around us. And I think if anybody is in denial about that, and, you know, we don't have that problem in our workplace, then it's very much to their detriment.
Mm. So how would you say that has affected Mando?
I think for Mando, we recognised this about 2 years ago. So we had employees who were struggling with their mental health, and in supporting them, we recognised how bad it can become. So what we were able to do is introduce this programme of wellbeing awareness, and we also have a very open culture. So we introduced a mental wellbeing team, people with lived experience who were able to talk to colleagues and say, this is my experience, this is what I've lived through, and this is where I am now. So people who've been on their own journey are now living very full and successful lives, and that can really help people who are struggling in that moment. So, you know, having that culture, people knowing that they can come and tell us if they're struggling, and we are then able to signpost on. So we work with Able Futures, who are a government funded support service. We've got an EAP, an employee assistance programme through AXA, where people can access counselling. And we always signpost to the Hub of Hope via Chasing the Stigma, where people can access things like Talk Liverpool for us, which is one of our local services, NHS services.
Yeah, brilliant. Just on that, Jake, how have Chasing the Stigma had to adapt in the last 12 months to respond to that spike in mental health problems? And I mean that not just in regards to employees, but from everyone across the UK.
Yeah, I mean, it's been a bit of a strange year for us as a charity, because as a small charity that relies almost entirely on public donations at the moment to exist, we have obviously had a lot of momentum going into 2020. We were growing, we were taking on staff, and then funding wise, things stopped. It was difficult for us to bring in funding. All fundraising activities stopped. Our training program that we developed that was face-to-face stopped. It's really hard, but we couldn't furlough staff. We couldn't take time off because demand on our services actually increased by 200%, 248% on one day, wow. Just the day of the announcement of lockdown, and then a 260 something percent when it then got extended. People were relying on us. So we had to just act. We had to find new ways of doing it. And ironically, 2020 actually probably turned into the most progressive year for Chasing the Stigma, because we were almost forced to change, because we were forced to work differently. But what I would say is that I think a lot of people used that opportunity throughout 2020 to find new ways of working. And from my point of view, working collaboratively a lot better and a lot more, not having that same risk to collaboration. And that allowed us then to work with people and work with businesses, work with companies and the general public to improve what we've got, build the Hub of Hope up, and to reach more people than we've ever reached before. So it's been I'll always look back on 2020 as a bit of a catalyst year for us, really, because it in many ways it was a milestone year.
Absolutely. No, that's brilliant. Thank you very much. So our webinars tend to unpack generally 3 key areas surrounding the topic of discussion, and we tend to explore the past, so how things used to be, the present, the current state of affairs, and the future, where I'll ask you to make some futuristic predictions about what the future of this issue might be. With that said, Dee, how did employers approach poor mental health previously and in the past?
I think for a lot of employers, they either weren't aware of the issues or they chose to bury their heads. So it's very much a case that some organisations still hold a lot of stigma. There's still that fear of judgment or repercussion if people are open. So what we know is that 90% of people who take a day off with stress tend to give a different reason. So if businesses aren't really unpacking, if they're not doing return to work interviews, if they're not asking staff in the one-to-ones, how is their well-being, then they're probably not getting to the root of the problem. So it's that thing that, if we don't talk about it, it doesn't exist, which obviously the reality is different. 602,000 days lost to work-related stress, anxiety and depression. It's a huge, huge issue, but it's very easily resolved.
So with the emphasis being on mental health, from my perspective, this only seems to have become such an important issue, Jake, in recent times. Let's say the last 10 years. Why do you think that is, when it's always been prevalent?
Yeah, I think there's been a shift, definitely been a shift, and I think part of that shift or a major part of that has been people speaking out about it. I think previous to 10 years, and I probably agree with that, I think there's been a bit of a status quo. I think there's been a bit of a lazy approach to mental health, if I'm being honest with you, which might not be as, maybe that's a bit unfair to say, but I think there's a misunderstanding, there's a miseducation, there's not, it's just almost gestures before all this, and it's something that people just didn't really take seriously. I think high profile cases of particularly suicide and people, celebrities speaking out about it has helped change that narrative a little bit. And I think Robin Williams actually, and the death of Robin Williams was a bit of a turning point for a lot of people, because here's somebody who a lot of people grew up with. He brought a lot of people joy. He was somebody who you would never think would be struggling, would be depressed. And his death, I know, speaking personally, was a massive shock, and it was a moment. But I think one of the biggest changes has been people with lived experience who now feel like they have the power to do something because it's not being done elsewhere. It's people with lived experience who are creating services. I could tell you now, and loads of different services of people who have lost somebody, who have gone through something themselves from place of loss or hurt or pain, who have said, well, I'm just going to do it. I'm going to create something. I'm going to create a service because I'm not going to wait for funding. I'm not going to wait for all these things. I'm going to do something about it. And it's that power in those people, and those with lived experience, that is forcing a change. And I think that's probably been the things I've noticed the biggest difference in the last 10 years, the last 8 to 10 years.
Yeah, that's really, I never thought of it through that lens, even with people like, is it Chester Bennington from Linkin Park? Yeah, you've changed the way I look at that, to be totally honest. It's a really good response. Do you agree with that response, Jake? Sorry, Dee. Not that I'm trying to start an argument between you both, but do you agree with what Jake said there?
I do. I think there's been a huge mind shift really with people. We're seeing adverts between Coronation Street and, celebrities are endorsing access to mental health services. So I think there's definitely been that change, that we are seeing other people talking about it, and therefore we feel more able to talk about it. I think the other thing is we've got this new generation coming up. So my children, kind of 18 to 24, are very open about their mental health. And as parents, we've had to adapt to understanding what that world looks like. And the fact that they're coming through and they're being open really helps other people to engage. And it's very positive for the future.
Yeah, no, that's really interesting. So we've already discussed the importance of maintaining positive mental health and how it's become prevalent in recent years. And to be honest, as you quite rightly said, about the 1 in 2, D, I don't know anyone that hasn't been affected by poor mental health, either directly or through friends or family. And I've absolutely hold my hands up high and say that I've definitely had my own experiences. And it's great to see how employers are really making efforts to improve their approach to caring for their staff and improving the way in which they care for their employees living with poor mental health. Just on that, Jake, how would you describe the issues surrounding mental health in the workplace in its current form?
I think we've come a long way, but I think we're only at the beginning of this. What Dee talked about there, and like the point I was making before, I think this is very much a people movement. I think the way that we're talking about mental health and the change to it is driven and enforced by people, and policy is behind ever so slightly, and policy and services are having to catch up with this movement, which I don't think is necessarily a bad thing, as long as things move a little bit quicker, because change from a person point of view is that's how we get change. But I think there's a lot of learning to do. We talk about 1 in 4, we talk about 1 in 2, we talk about 1 in 6, like what we're saying here. But 6 in 6, 4 in 4, 2 in 2, absolutely every person has mental health. We've all got mental health, and we shouldn't just be waiting for people to be sick before we're reacting to people being sick. We need to be proactive. We need to have it as part of the culture. So every organisation, every business that has people should have mental health at the very core of what they are doing from a day-to-day basis. We can't just wait for people to become unwell before we start that, because that's how you make a difference. So I think as I said, there's a long way to go. I think there's a lot of, again, if I'm going to be kind, I think it's more a lack of understanding, a lack of education, a lack of awareness of the approach to take. But it needs to be more than gestures. It needs to be more than just Mental Health Awareness Week next week. It needs to be more than just Mental Health Day in October. It needs to be more than just a couple of people trained. It needs to be at the very core of every single business. That's what we're trying to do, working with Dee as well. It's about, let's train everybody. Let's make this part of that every day in an organisation. So we've come a long way, but as long as people are open and employers are open to learn, then I think there's the hardest parts have already been done. It'll make it easier now. And sorry, just a final thing, but I think one of the biggest changes has been that we see people as people. We don't just see them as workers. And I think in the last 12 months, we've been able to see people as people, because we're able to see everyone's house. You don't have to hide the fact that you've got a cat and a dog and kids. I'm judging people by their decor and everything these days. I feel like I know people more. You don't have to pretend to not be people. We're not just workers. We are people and individuals.
Yeah, great. I'm pleased I've got this background on, so you can't judge my decor. That's exactly right. So just on that, Dee, and what Jake's been saying, what have Mando introduced in the last 12 months to support their staff?
Well, we were very fortunate because we already had a good structure in place. We've got the Workplace Wellbeing Charter, we've got wellbeing policies and strategy in place. But what we recognised very quickly when we went to this diverse, everybody working from home, nobody working in this community that we built, is that we needed to know how they were doing. So I check in with every individual in Mando at least once every 10 days. So it might just be a Slack message, it might be during the course of a conversation or a meeting, it might be that I pick up the phone. But what I'll do is I'll see how people are, and if I'm getting an indication that I don't think they're great, we use something called form score. So, on a scale of 0 to 10, how are you? And that gives me a good indicator of whether I need to be signposting. So only in the last 12 months, we started using Able Futures, and we've had really good feedback from that. So those wellbeing check-ins have been really important. We've also done things like just little treat boxes. So just land through the letterbox with no warning, and it might be, chocolates at Christmas time. We've done healthy snacks. We've done stress management kits. So it's just about people recognizing that we care. And we're not just seeing them as workers, coming back to Jake's point. We want them to feel loved and cared for and supported. Yeah. We've just relaunched our social and wellbeing group. Obviously, we've been limited what we could do so far. People had a bit of kind of Zoom fatigue. So that we paused that for a period, but we've re-engaged with that. And that will be back to raising awareness of what's going on in the world, whether that's physical well-being or mental well-being. So again, we're starting that proactivity. We've got something called Go One, which is a training platform, lots of wellbeing courses on there. I'm running bespoke courses with the staff, so addressing the issues that are coming through. So we've done a stress management, self-care. So we're able to engage with whatever the moment is telling us and give real-time support for people.
Well, no, I've been the recipient of one of those treat boxes, and I don't think I've balanced it well enough with exercise, because this shirt is a little bit tight, to be totally honest. Yeah, but it's definitely the things that you say now. I've definitely experienced them, and they've been vital, absolutely vital. So thank you both for that. So we're going to move on to my favourite bit, which is the future. And it's clear to see that from the discussion that we've already had, and from social media, from news headlines, that the businesses are supporting their staff and protecting their mental health has been a colossal change in the last 12 months. Just on that, Dee, how do you see that problem evolving, and what systems are Mando putting in place to protect staff?
So we anticipate a huge peak in anxiety and stress as people start to return to what, I know everybody hates the term, but the new normal. You know, we've all been living in our little bubble. We feel safe and healthy. And for some people, I know within Mando, we've had about 25 new starters in the last year. So for those people going in and meeting people for the first time, having worked with them, you know, people having to go through maybe using public transport or go back through our building, we're on the 4th floor using lifts, all kinds of things will trigger people. So we've got to prepare for that. So whether that's supporting them in a talking context, whether it's preparing them with training and education, whether it's giving them that flexibility of, you know, it doesn't really matter to us whether you work at home or work in the office, do what feels right on the day. For some of us, we need to be in the office and engage with other people and have that collaboration and socialization, you know, and some days that just feels more welcome than others.
Yeah, absolutely. So how are you empowering members of the Mando team to identify signs of poor mental health in their colleagues?
So I'm currently a mental health first aid instructor. Obviously, we have mental health first aiders in place, but we're going to expand that. So there's more people who have that knowledge. We also have a large number of people who haven't been through Jake's Ambassador of Hope program. So we're going to reinstigate that so that everybody's had that peer-to-peer support training. And we're going to encourage people to continue to share their stories. So those people with lived experience who are putting their hands up and going, I'm here if you want to talk about what you're going through, because that's so powerful. Yeah,
absolutely. So Jake, a question for you now. What have been the most effective systems that have been implemented to support people living with poor mental health?
Well, I think, as I said before, collaboration has been, I have to say, it's soared in terms of people willing to learn from one another, and that's allowed us at Chasing Stigma with the Hub of Hope to develop and work in partnership with different organisations. I think Dee's mentioned a number of different organisations already. It's about moving away from this rivalry or this perceived competition, or even in very basic terms, just working in silos, to say you're allowed to signpost to other people, you're allowed to have an effective system with other organisations, learn from each other and see what you can do. And certainly from our point of view, an effective system from our side is signposting via the Hub of Hope, looking at the support that's available. And again, I'll just quickly mention this, but by having something like the Ambassador Hope training or with mental health first aid training, it's not just saying, well, we've got our own internal support, and that's there for our employees, and you know, they don't need anything else, because we know that there's a lot of different reasons why people don't access that internal support, for stigma and different things, and they worry that it's going to come back on them. So that's why you need to look at alternatives. Still have that, really important that you do, but look at the other alternatives, look at the other signposting that's available as well, because it might take somebody texting a different service or going to a different service in order for them to then come round and build that trust to go to that internal support. So you've got to be open to collaboration.
Brilliant. Thank you very much. So before we move on to some questions from today's audience, I just want to ask you both one last thing. So whilst we keep our webinars conversation led and exploring the key issues, we also like to focus on practical suggestions which can be implemented to help our viewers excel. With that in mind, what would you say is your top tip, your key takeaway, which you think companies can adapt to make a difference in this area to rise and overcome the challenge of poor mental health in the workplace? Dee, do you want to kick that one off?
Yeah, absolutely. So I think it's really important to accept that mental illness is in our workplaces. You know, as Jake said earlier, we all have mental health, and at times we all dip below the line. So what we need to be able to do is recognise that. And more importantly, for people to be trained and aware and have that preventative measure in place so that they don't dip too far below the line. They recognise it when it's early days. They seek support either internally or externally. They do the self-care and practice those supports that help them to recover. And if need be, they access those external supports, GP, NHS crisis teams, etc. Just to be able to get better as quickly and as effectively as possible. And for businesses that do invest, remembering that every £1 spent is £5 return.
Yeah, absolutely. Jake, what would your response be to that question?
Yeah, it would be to echo what Dee has said, but the main thing for me is to have an everyday approach, to change the culture within an organisation, to not just think about mental health as mental illness, to not think that talking about mental health means somebody is going to tell you like really horrific experiences. People may talk about their experiences, which is obviously a good thing, but we need to change this narrative around mental health meaning mental illness, mental health meaning something bad. We talk about our physical health on a daily basis in workplaces. We put fruit out, we talk about initiatives, we talk about doing different exercise and all these different things. We need to have that same approach to mental health, and actually the same things can work for your mental health as well. So it's just tying all that in to say this is for your good physical and mental health. It's just making that as part of that everyday life for an organisation, the very core of it. And as Dee said, if you think that you don't have a problem with mental health in employees, then maybe you need to go away and have a little look at those who are off sick for different things. How many, it's much easier for us to say that we've got a headache or we've got a stomach bug if we feel like we can't say that we're not feeling mentally as good as we should do. So by changing that culture, you can bring that out in people.
Yeah, that's really interesting. Thank you very much to the both of you. I think we've got time for one question or maybe two. So have we had any from today's audience?
Yeah, it depends how quickly I speak, I suppose. So it's great to have Jake back on. Obviously, we had him back in a previous episode right at the beginning talking about this mental health crisis on its way. And look, we're in it now. So really powerful conversation. Thanks, Dee and Jake. There's one saying about that we've heard that the Hub of Hope is part of the government mental health recovery action plan. Jake, can you tell us a little bit about that?
Yeah, so I mean, like what Dee was just saying, the government have recently released a COVID-19 Wellbeing recovery action plan. They've highlighted and they recognise that there's going to be, as you've just said there, huge impact on people's mental health as a result of COVID-19. And yes, they've included the Hub of Hope as part of that as probably the main signposting tool within the report to say, look at the help and support that's available. NHS support is there. Reach out, try and get that NHS support. But if you are met with waiting list or thresholds, or you simply don't want to go to NHS for whatever reason, because we know people think COVID-19 is a reason not to go to hospital or other places, then look at the alternative, look at the other support, look at charities, look at private, look at community groups. And that's what the Hub of Hope is there to do. It's free to download, or you can go on hubofhope.co.uk.
Yeah, and you're even looking at other places, aren't you? Like car parks, train stations, people that would look for that help.
Yeah, it's about normalising this conversation. So we're trying to get the message out to people in their everyday lives, not just waiting for people to go to a doctor's or go to hospital in order to be aware of the mental health support. Be aware of it, know about it. We hope you never use it, but if you ever do need it, then reach out for that help support at an early stage.
Yeah, brilliant, Jake. And just one for you, Dee. You were talking about the statistics of lost work days. Is that actually a disclosed data? Is it that people have come in and said, I was off because of mental health? Or could they be hiding it and the actual figure could be even higher?
Yeah, the figure is very much likely to be even higher. So those are declared mental health work days lost, where actually we know. And coming back to Jake's point, sometimes it's, I've got a headache, I've got a stomachache. They are physical presentations sometimes of us being mentally unwell. So sometimes it's hidden in that way, not deliberately that people feel they can't talk, but just that they're exhibiting in a different way. So yeah, very much so. We expect it's higher.
Brilliant. And there's probably more, but we'll have to answer them after the webinar. I think this conversation could go on for a lot longer, but back to you, Luke. Thanks.
Yeah, I've certainly got a lot more questions that I want to ask, but I'm very conscious of time. So, but yeah, thank you very much to the both of you for joining this morning, and thank you to those of you that have listened in. As always, this will be going out on demand, and we'll share it with you early next week. Thank you very much, and have a lovely day. Speak to you soon.
Take care.
See you later. Bye.
Bye.